The first thing he does is he takes her blood pressure. He sees it's actually in control and manageable. That's a check off the list. He can cross off addressing that quality gap. He also asks about her inhalers because he observes she's tried several inhalers, but she's still going to the ER. Diane says, "Yeah, I've tried these, but they haven't worked as well as I would have liked. And I'm really trying to get out and go on hikes and take advantage of the outdoors on this RV trip." The provider thinks about it and says, "You know, I have an option for you. How about we prescribe an asthma medication that's not an inhaler, but an injectable, Xolair?" And she says, "That sounds like a good idea. I really want to get out hiking harder trails again. I'm willing to give it a go." Finally, he addresses the missing diagnosis code for depression. With a few screening questions, he is able to confirm her diagnosis and encourages her to keep taking her Lexapro and to continue to share how she's feeling with him and her mental health provider. Throughout this discussion, the provider has been making note of Diane's conditions in his converged patient assessment application. In this software, he completes her SOAP note, which includes confirming the type of encounter as an outpatient visit, documenting her blood pressure reading so it indicates her blood pressure is in control, completing depression screening questions, which allow the physician to indicate the severity of her depression based on his conversation with Diane about her quality of sleep, energy levels, appetite, any trouble concentrating, and any thoughts of self-harm, adding the diagnosis code for her depression, and confirming her depression medication as Lexapro, confirming Diane's asthma as a chronic condition and adding her new asthma medication, Xolair, documenting the appropriate visit code for this encounter, and finally, saving all this information and submitting her Medicare SOAP note. So now, through this very structured encounter, the provider's been able to close a quality gap and a risk gap. He's been able to address Diane's asthma, hypertension, and depression, and submit all this in a documented SOAP note back to the health plan. This puts the physician and the health plan on the same page when it comes to Diane's care. Plus, Diane feels great about her experience. She's got a new medication that's going to help her with her asthma. She got her other conditions addressed, and it was all quick and easy for her.